Good. Chapter 27, or the nervous system 2. Noun, adjective. Absence, absent. Diminution, diminished. Flaccid, flaccid. Spasticity, spastic. Western, wasted. Point 2. I'd like you to relax. I'm just going to move your arm up and down. Is muscle tone. Can I see your hands? Muscle, muscle bulk and possibly involuntary movements. Now I'm going to straighten your your arm out. Try to stop me. Power. Can you touch me? Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Point 3. A flaccid hand droops limply to form a right angle with the wrist. Brisk reflexes are reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. A tic is a form of involuntary movement. A K is often used to test the plantar response. His coordination was poor. He could he couldn't perform rapid alternative movements. A reflex hammer is used to test reflexes. When something is diminished, it is less than normal. Point 4. A patient is brought to A and E in coma. When her name is spoken, she opens her eyes, but she doesn't answer a question or obey instructions. What is her GCS score? Her GCS score is eye-opening to a speech 3. Verbal response, none, sorry, 1. Motor response, none, so 1. Good. Chapter 28, or oncology. Complete the table. Point 1. Verb, nouns, adjective. Curative. Excess, excisions. Grow, growth, growing. Invade, invasion, invasive. Obstruct, obstruction, obstructive. Palliate, palliation, palpate. Palpate, palpation, palpable. Spreading, swelling, swollen. Okay. Point 2. The notes below are about the patient described in the opposite. Use them to put the sentence in the correct order. Okay, good. On examination, his temperature was 38.8 Celsius. There was a smooth, firm 344 cm mass in the right supraclavicular fossa. There were enlarged lymph nodes in both axial and inguinal areas. There was smooth, firm. Okay, sorry. His mouth and throat were normal. His pulse rate was 100 for minute regular, and blood pressure is 112 for 66. His cardiovascular and respiratory system were normal. On abdominal examination, there was a mass pulp 3 cm. below the left costal margin, and examination of the central nervous system was normal. Point 3. Distant spread of tumor cell is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasize are benign. Are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. 29 or pregnancy and childbirth. Okay. Complete the sentence. The point 1. A baby that's born a week before the EDD is premature. A termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage of labor is an indication for cesarean section. It was a breech presentation and delivery was by forceps. 6. A miscarriage is another term for a spontaneous abortion. The cord was bound tightly around the baby's neck and it was unfortunately stillborn. 29.2. Verb and noun. Abort, abortion. Deliver, delivery. Induce, induction. Miscarriage. Present, presentation. Terminate, termination. Point 3. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric story, she had a pregnancy when she was 18, which was terminated, and another one a year later, which spontaneously aborted. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section.